Different stressors like trauma, surgery, burns, and sepsis can affect homeostasis to variable extent. These stressors result in changes in metabolic process, and these changes are called metabolic response to stress. So stress results in alteration in metabolic process, and these alterations help in survival and repair mechanisms. These stressors have different components. Like trauma is associated with pain, tissue damage, and hypovolemia. Similarly, burns are also associated with pain, tissue damage, and hypovolemia. However, type and degree of tissue damage will be different in different cases. Similarly, degree of pain and hypovolemia is also different. Surgery also results in pain and tissue damage, and it can also result in hypovolemia. Malnutrition can be present before surgery, and surgery can also be associated with ischemia and reperfusion type of injury. In case of sepsis, inflammation and immune response to foreign antigens can result in tissue damage. Different toxins derived from pathogens like endotoxins can be present in case of sepsis. So we can see these stressors appear quite different, but they have similar components. So metabolic response to these stressors will also be quite similar. So metabolic response to trauma will be similar with metabolic response for burns, surgery, and sepsis. Metabolic response to stress is divided into three phases. First phase is called shock phase or ebb phase. This phase can last for 12 to 36 hours. During this phase, there is decrease in metabolic rate and decrease in oxygen consumption, and there can be hypotension due to volume loss. During this phase, body attempts to conserve energy sources for later use. Next phase is called catabolic phase or flow phase. This phase can last for weeks in case of sepsis or major trauma, and it usually lasts for 3 to 8 days after surgery. During this phase, body stores of carbohydrates, lipids, and proteins are broken down that help in survival and tissue repair. Last phase is called anabolic phase. During this phase, body stores of lipids and proteins are restored. Three systems mainly contribute in metabolic response to stress. These systems are sympathetic nervous system, neuroendocrine system, and immune system. Activation of these systems result in breakdown of carbohydrates, lipids, and proteins. It also results in inhibition of anabolic activities and conservation of water and sodium. Inflammation helps in tissue repair and control of infection. First system that is activated in situation of stress is sympathetic nervous system. Signals of pain, tissue damage, and hypovolemia reach to brain through somatic and visceral nerves. These signals result in activation of sympathetic nervous system and release of noradrenaline and adrenaline. These catecholamines result in tachycardia and increase in force of contraction of heart. It also results in inhibition of anabolic activities that will result in decrease in GI motility and inhibition of insulin secretion. Catecholamines also result in release of glucagon, and glucagon leads to breakdown of glycogen to glucose, and triglycerides to free fatty acids. So activation of sympathetic nervous system ensure adequate oxygen supply and supply of nutrients to cells of body during situation of stress. Activation of sympathetic nervous system also results in release of renin that will ultimately result in secretion of aldosterone that helps in conservation of water and sodium. Same signals along with cytokines result in release of different hypothalamic hormones, and these hormones affect secretion of pituitary hormones. Pituitary gland secretes ACTH, growth hormone, and ADH. ACTH results in release of cortisol, and cortisol is one of main hormone of catabolic phase. Inflammation in response to infection and tissue damage results in production of cytokines. These cytokines can have many systemic effects, like IL-1 results in fever and IL-6 results in production of acute phase proteins and can affect ACTH release. Different mediators of inflammation produced during this process also result in increased blood flow to area of inflammation and increased vascular permeability. Some anti-inflammatory cytokines are also produced that help to control inflammatory process. So cytokines have many systemic effects, and cytokines can also result in breakdown of lipids, proteins, and weight loss. Now let's discuss about different hormones that contribute in catabolic phase. Glucagon results in breakdown of glycogen and gluconeogenesis. Glycogen stores can only last for few hours in situation of stress, so gluconeogenesis is also initiated to ensure adequate blood glucose levels in situation of stress. Glucagon also results in breakdown of lipids to free fatty acids. So both glucose and free fatty acids are available for use by cells. Growth hormone has many effects that are similar to glucagon. In addition, growth hormone has anabolic effects. These anabolic effects attempt to counteract some of catabolic effects of other hormones. Cortisol is one of main hormone of catabolic phase. Its main actions are gluconeogenesis and protein breakdown. Protein breakdown continues throughout catabolic phase, and resulting amino acids are used for gluconeogenesis and for synthesis of other proteins. Another important effect of cortisol is immunosuppression. So there is increased risk of infections during catabolic phase. Another hormone that contributes in metabolic response to stress is insulin. Insulin secretion is first reduced after exposure to stress, and then its levels return to normal. Several hormones counteract actions of insulin. In addition, there is resistance to action of insulin in skeletal muscles and adipose tissue. This resistance is due to changes in receptors and glucose transporters in these tissues. Presence of counter-regulatory hormones and insulin resistance ensures adequate blood glucose levels during situation of stress. Another set of hormones affect water and electrolyte balance. These hormones help conservation of water and sodium to keep adequate intravascular volume. ADH is released from posterior pituitary in response to stress, and it results in increased water reabsorption from kidney. Renin also results in secretion of aldosterone, and aldosterone results in increased water reabsorption and increased sodium reabsorption from kidney. Other effect of aldosterone is increased potassium excretion. So increased water and sodium reabsorption help to keep intravascular volume. Now let's discuss different metabolic changes that occur in different organs and tissues during metabolic response to stress. Liver is main site of gluconeogenesis, and main precursor for gluconeogenesis is amino acids derived from breakdown of proteins. Lactate is also produced in higher amounts during response to stress, and this lactate is converted to glucose in liver. Acute phase proteins and ketone bodies are also synthesized in liver. However, ketogenesis is not as marked during metabolic response to stress as it is during starvation. Main changes in skeletal muscle include increased protein breakdown and insulin resistance. Amino acids resulting from protein breakdown have important functions. However, if this process continues, it can result in significant wasting of muscles and weakness. Changes in adipose tissue include breakdown of lipids to free fatty acids and insulin resistance. In kidney, actions of antidiuretic hormone and aldosterone results in increased water and sodium reabsorption. Another effect of metabolic response to stress is increase in basal metabolic rate. Sympathetic stimulation and cytokines are main reason for this increase. Increase in BMR is highest after burns and then after major trauma. Major trauma can result in 20 to 25% increase in BMR, and similar increase is observed after major surgery. So main features of catabolic phase include hyperglycemia, protein breakdown, breakdown of lipids, insulin resistance, and increase in basal metabolic rate. Now let's discuss how these changes help during metabolic response to stress and how these changes can result in complications. Hyperglycemia is one of main feature of metabolic response to stress. Several factors result in increase in blood glucose level. These factors include breakdown of glycogen, gluconeogenesis from different precursors, and insulin resistance. Several hormones along with insulin resistance result in increase in blood glucose levels. Adequate blood glucose levels help during metabolic response to stress, as glucose can be used by almost all cells in body, and it can be used in both aerobic and anaerobic conditions. So glucose is preferred source of energy during situation of stress. Glucose can be main or only source of energy for some organs or cells like brain, leukocytes, and RBCs. In addition, glucose can also be used by hypoxic cells and regenerating cells even if there is impairment of blood flow. In this situation, glucose diffuses from extracellular space to cells. So high blood glucose levels help in this diffusion process. Glucose can also help to maintain intravascular volume due to osmotic pressure. For these reasons, relatively high blood glucose levels are maintained during response to stress. However, if blood glucose levels are too high or if it continues for a prolonged period of time, it can result in different complications. Hyperglycemia can result in mitochondrial dysfunction and can result in different infective complications. It can also impair wound healing and can result in significant osmotic diuresis. Due to these reasons, hyperglycemia is associated with increased morbidity and mortality. Other important feature of catabolic phase is protein breakdown. This process occurs mainly in skeletal muscle but can also occur in other areas, resulting in negative nitrogen balance. This protein breakdown can be significant, like in case of sepsis, up to 1 kilogram of muscles can be lost daily. Significant muscle mass can also be lost after major trauma, burns, and surgery. Cortisol is mainly responsible for protein breakdown, and cytokines also contribute to this process. Amino acids derived from protein breakdown have important functions. These amino acids are used for gluconeogenesis and for synthesis of proteins that help in wound healing. These amino acids are also used for synthesis of acute phase proteins. Several acute phase proteins are also synthesized during metabolic response to stress. These proteins have several functions. Levels of these proteins can be measured to assess severity of metabolic response. Although amino acids derived from protein breakdown have important functions, however, excessive protein breakdown will result in different complications. It can result in muscle weakness that will affect mobility. It can also impair wound healing and can result in increased risk of infections. Involvement of respiratory muscles can result in breathing difficulties and other complications like pneumonia. Factors that can reduce protein breakdown include adequate nutrition with adequate amount of proteins and early mobilization if possible. In case of trauma and sepsis, insulin administration can slow this process. By these measures, protein breakdown can be slowed down, but it cannot be completely stopped. Triglycerides in adipose tissue are broken down to free fatty acids and glycerol during metabolic response to stress. Free fatty acids are used as source of energy, but it requires adequate amount of oxygen and normal function of mitochondria. In summary, during metabolic response to stress, body stores of carbohydrates, proteins, and lipids are mobilized and used as source of energy. Amino acids resulting from protein breakdown are used for gluconeogenesis and for synthesis of proteins that help in regeneration and healing of injured tissues. So stress response helps in survival and repair of injured tissues. However, if this response is excessive or prolonged, it can result in different complications. Severity of metabolic response is associated with severity of injury and type of injury. Burns are associated with high degree of catabolic response. However, major trauma and sepsis can also result in significant catabolic response that can result in different complications. Presence of infection and starvation also increase severity of metabolic response. So stress response has benefits, but it can also result in different complications. We cannot completely stop this process. However, we can attempt to modify this process to decrease incidence of complications. In case of surgery, by avoiding prolonged preoperative fasting and by providing carbohydrate-based oral solution before surgery can result in decrease in insulin resistance and decrease in protein breakdown after surgery. Adequate fluid administration is also important, as hypovolemia can activate sympathetic nervous system and excessive fluid administration can result in accumulation of fluid in extracellular space. Early mobilization helps in reducing protein breakdown and it also helps in prevention of other complications. Epidural analgesia in case of major surgery also results in decrease in insulin resistance and decrease in degree of protein breakdown. Adequate nutrition can help to modify metabolic response and can help to decrease complications associated with this response. In contrast, starvation during this period can increase severity of metabolic response and can increase complications as well. As there is increase in basal metabolic rate and protein requirements during stress response, so if we provide adequate calories, proteins and amino acids, it can result in decrease in protein breakdown, but it will not completely stop this process. Enteral route should be used whenever possible, as along with other benefits, it also helps in maintaining integrity of enterocytes. Insulin resistance during stress response contributes to hyperglycemia and can result in increased protein breakdown and decrease in protein synthesis. By providing exogenous insulin, we can keep optimum blood glucose levels and it can also result in decrease in protein breakdown. So insulin therapy can help in modifying stress response and can help to reduce complications associated with this response. In summary, different stressors result in metabolic response that is quite similar regardless of type of stressor. During this response, body stores of carbohydrates, proteins and lipids are used as source of energy and for repair of injured tissues. So this adaptive response helps in survival and repair process. However, if this response is excessive or if this response is prolonged, it can result in significant complications. We can modify this response to an extent to decrease these complications. However, this response cannot be completely suppressed and complete suppression of all aspects of this response is also not desirable. For example, intensive control of blood glucose levels with insulin during this situation is found to be associated with worse outcomes than avoiding excessive hyperglycemia.